When the highest court in the United States strikes its gavel, the fractures often spread far beyond the specific case at hand. Right now, a high-stakes legal battle is making its way through the judicial system, testing the constitutionality of state bans on conversion therapy for minors. At the center of this tension is Chiles v. Salazar, a case pitting a state's regulatory authority directly against an individual practitioner's constitutional rights. The plaintiff in this case argues that because her conversion therapy sessions are conducted entirely through counseling, her practice is, strictly speaking, just talk. And by framing her medical service as purely verbal, she mounts a severe First Amendment challenge against the government's ability to restrict her speech. As this challenge works its way through the courts, both the media and the public are broadly misinterpreting what a ruling in favor of the plaintiff would actually mean. There is a widespread yet entirely incorrect assumption that if the Supreme Court strikes down these state legislative bans, the practice of conversion therapy will be fully legalized. This misconception stems from the public equating two distinct concepts, assuming that because something is not statutorily banned by the state, it is therefore legal and safe to practice. This diagram illustrates reality of how the medical system is regulated. Accountability relies on a two-pillar structure. The first pillar consists of state statutory bans. These are preemptive laws drafted and passed by politicians in a legislature. When a practitioner launches a First Amendment challenge against the state, they are only attacking this specific legislative pillar. But the second pillar is entirely different. It consists of common law, professional discipline, and civil torts, such as medical malpractice. This second pillar operates completely independent of legislative bans. It is governed not by politicians, but by strict clinical standards, which means even if the Supreme Court strikes down every state legislative ban in the country, conversion therapy remains a prosecutable civil offense because it violates the professional standards of care. To understand why this civil liability remains intact, we must examine the specific First Amendment logic used by practitioners fighting the bans, like Colorado counselor Kaylee Childs. Her core premise is straightforward. Because her therapy consists strictly of spoken words, any state attempt to regulate it is an act of government censorship. She claims the state is unconstitutionally censoring a disfavored point of view regarding an individual's ability to change their sexual orientation. But this argument collides with a massive historical counterargument regarding how the law actually treats state-licensed professional speech. States have historically regulated professional conduct entirely differently than standard public speech, a precedent dating back to the American colonies. The law recognizes specific talking professions, like counseling, psychiatry, and law, where speech itself is the commercial service being sold. To perform these exact speech-based services, the law mandates an absolute requirement: you must obtain a state license. Acquiring a professional license legally transforms your words. You are no longer engaging in free public speech. You are engaging in regulated professional conduct. Once your speech becomes regulated professional conduct, you are bound by a foundational legal concept known as the standard of care. This requires professionals to provide services that comport with established evidence and expert consensus, an obligation enforced since before the United States was founded. Legal scholar David Cole highlights the absurdity of ignoring this standard with a clear comparison: a lawyer providing official legal advice to a client based solely on astrology. Or consider a licensed therapist claiming they can cure physical blindness entirely through talk therapy. Both of those examples consist entirely of words. Both are speech, yet neither is protected by the First Amendment. The rule is definitive. The U.S. Constitution provides absolutely no First Amendment right to commit professional malpractice. A professional speech is legally protected only so long as it adheres to the recognized evidence-based standards of their specific profession. This raises a crucial question. If the state legislature does not set the clinical standard of care, who does? The answer is the consensus of major medical and mental health organizations, specifically authorities like the American Psychiatric Association and the American Psychological Association. When it comes to conversion therapy, these authorities maintain a unified, objective stance. Look at their exact terminology. The practice has been discredited by every major medical organization and is universally condemned as junk medicine. The consensus has determined through extensive research that it is entirely ineffective at changing a person's sexual orientation or gender identity. More critically, they have determined that the practice actively causes severe psychological harm to the patient. Because of this overwhelming consensus, conversion therapy is classified as an objective, undeniable deviation from the established standard of care for mental health professionals. This legal and medical classification is not arbitrary. It is forced by raw, measurable clinical data regarding patient outcomes. Patients subjected to the practice face severe psychological risks, including documented spikes in clinical depression and extreme, sustained anxiety. The most measurable and devastating risk falls on LGBTQ youth, who see a drastic increase in rates of self-harm. This chart visualizes the severity of the data. LGBTQ youth subjected to conversion therapy are over twice as likely to report multiple suicide attempts compared to the baseline. This specific data point is why the practice is a deviation from care. It's measurable mortality. Ignoring this data and performing the practice anyway constitutes a gross breach of a therapist's primary fiduciary duty to protect their patient's safety. That breach of duty connects the clinical data directly back to the legal framework of actionable civil liability in the court system. This diagram shows the mechanics of that liability. When a practitioner violates the standard of care with an ineffective and harmful practice, they trigger two distinct legal vulnerabilities. The first mechanism is medical malpractice. Intentionally causing psychological trauma through a discredited method directly exposes the practitioner to civil lawsuits from their victims. The second mechanism is consumer fraud. Charging a patient money for an explicitly debunked service that claims to do something medical science says is impossible is a fraudulent business practice, entirely independent of the medical harm caused. Which brings us back to the current context at the Supreme Court and the ongoing fight over state legislative bans. Returning to our architectural model, we can see that a ruling against a state ban only addresses the limits of preemptive government censorship. The mechanism of civil liability remains completely untouched by these First Amendment rulings. The absence of a criminal or statutory ban does not grant a professional license to do harm. As long as the clinical consensus recognizes the severe trauma caused by conversion therapy, the civil courts will remain a viable, powerful, and constitutionally sound avenue for accountability.